Hello, and this is Lucinda Nord with Indiana Association of United Ways, and I welcome you to our first of the 2014 legislative session legislative update webinars. This is a joint project between the Indiana Nonprofit Resource Network, our statewide nonprofit training service through the Indiana United Ways, the Indiana Association of United Ways, and our coalition partner, the Indiana Coalition for Human Services. So we thank you for joining, and I'd like to introduce our other speaker today. This is usually a tag team effort between the Government Affairs Committee of the Coalition for Human Services. So I'm Lucinda Nord, and not with us because of the very fast activities in the State House is Mark St. John, who co-chairs that committee with me. And then David Sklar is pinch hitting for him today, and David is our former president of the Indiana Coalition for Human Services. And David, if you could just introduce yourself.
Sure. Hi, I'm David Sklar, again, Director of Government Affairs with the Jewish Community Relations Council, and work closely with the Indiana Coalition for Human Services. So looking forward to speaking with everybody today.
Great. And David, if you could just speak up just a little bit when you speak, and I'm going to have you give our quick introduction to this 2014 session of the Indiana General Assembly.
Sure. So the current legislative session of the Indiana General Assembly started the first week in January with a little bit of delay because of the weather, so already started a little bit behind schedule and trying to catch up a little bit. Had the first day or so snowed out and weathered out, so the members came in a day late. This is a short session, so we are not coming off an election year, so that for the most part, these are the same legislators and the same political dynamics that we were looking at in the last legislative session of the General Assembly. So, as you can see, the Republicans continue to control supermajorities in both chambers of the General Assembly. In the House, we have 69 Republicans and 31 Democrats, and in the Senate, 37 Republicans and 13 Democrats. For a couple of different reasons, including a couple of retirements, a couple of appointments to some different statewide positions, and unfortunately, one legislator passing away over the interim period. We had a couple of new members appointed to the Indiana General Assembly by their local communities. Greg Beamer from Modoc, Casey Cox from Fort Wayne, and Holly Sullivan from Evansville. So those are a couple of new faces that just sort of have added to the overall wholesale turnover that we've seen in the last couple of election cycles. So continuing to be a lot of new faces down at the General Assembly. Have obviously some hot issues for 2014. First and foremost is the House Joint Resolution 3. This is the marriage amendment that would define marriage in Indiana and place a few other provisions on the ballot potentially in 2014. Should that amendment pass the General Assembly this year, it would be on the 2014 ballot. That process is ongoing right now, with a House committee just having voted last night to send that measure to the full House for debate next week. So that's obviously a very big and defining issue for the session, and one that could potentially take a lot of oxygen out of the General Assembly to deal with a number of other issues over the course of the session. So early education and pre-K is an issue for all members, both Republican and Democrat, high on the priority list for all of the caucuses. A couple of bills that we'll talk about in a little bit moving through the General Assembly right now. So it looks like the state will take a couple of steps towards some early education programs here in the state. Tax issues, one of Governor Pence's big proposals for this year, it would be the elimination of the business personal property tax, and then also some individual tax exemptions and credits. The personal property tax, obviously a lot of impact on local communities. This would be revenue that would be lost by local communities, and they're certainly looking that if this property tax would be cut to make up that revenue in some other fashion. So a lot of questions about how local communities could make up that revenue. Healthcare, we continue to discuss implementation of the Affordable Care Act. January 1st was when the Affordable Care Act really went into effect. Obviously, we were dealing with some problems with the website, the healthcare.gov, and implementation in the fall and moving into January. So some implications on how that is being implemented here in the state. Continue to work on the issue of Medicaid expansion and closing the healthcare coverage gap that will exist for our low-income residents, since the state has not decided at this point to expand the Medicaid program as prescribed by the ACA. Families and children, another proposal from the governor to increase adoption subsidies and tax credits and promote adoption in the state. We're talking a lot about entitlement reform here in the state, some different proposals around TANF and SNAP eligibility. Education reform continues to be a big topic, talking about teacher credentials and some different bills and provisions around charter schools. And then we have some other issues that continue to be on the agenda and have been for the last couple of years, including the Ag-Gag bill and mass transit.
Okay, and the next slide actually shows, if I could get there, just the list of the governor's priorities as he outlined in the State of the State address. This was well documented in the media, and you have that on your slides. We're not going to go through each of these, but just to give you an idea of how he outlines, the governor will outline his own legislative priorities and then give some level of direction to legislators to say, please do this. Some governors will be very prescriptive in terms of how they would like to see certain things legislated, and Governor Pence perhaps is more of a big picture governor, really outlining the priority and then saying, for example, to the legislature, it's really up to the legislators to figure out the how part. So this just gives you a couple examples. David, do you have anything else about the State of the State?
No.
Okay.
Thank you.
And then you see just our own legislative priorities through the Coalition for Human Services. We tend to group our legislative priorities around really helping as a human service community promote healthy Hoosiers, promote policies that support working Hoosiers and working families, support policies that promote workforce-ready graduates, and that really takes into account a lot of different areas in education and training. We have a strong promotion of accountability and outcomes with government spending, and state agencies and ICHS, as many as you are familiar, has been very involved in, for example, over the years with FSSA and its modernization efforts and other initiatives within state government and how state agencies work together. And then lastly, ICHS works in the area of thriving communities. What are the things that make our communities really strong? So that's how we've tried to group them. Not all of the bills that we're about to go through really fit into one of those categories. So the categories don't make as much don't mean as much as perhaps the bills themselves. So let's walk through some bills grouped by areas. So David, do you want to start off talking a little bit about some of the coverage expansion bills and those bills related to the Affordable Care Act?
Sure. So this has been a high priority for the Coalition for Human Services for the last couple of years since the Supreme Court ruled on the constitutionality of the Affordable Care Act. When they did so, I think probably everybody knows that they left the decision to states whether states would choose to expand their Medicaid programs up to 138% of poverty or not. So far, Indiana has not decided to expand its program, and again, this is something that we continue to work on, urging the state in the Pence administration to go ahead and expand that program in one fashion or another, just to close that coverage gap of about 400,000 low-income Hoosiers that currently are either make too much money to qualify for the existing Medicaid program or not enough money to qualify for subsidies on the individual market in the federal exchange. So a couple of bills that we're looking at regarding healthcare expansion. House Bill 1309, this is Chairman Ed Clare's bill dealing with the issue, coming up with some proposals on how to expand the program and urging the administration to negotiate with the federal government on how exactly we would expand the program. This bill has not received a hearing at this point, but we are urging Chairman Clare and Speaker Bosma and a number of other members to have a hearing on this bill so that we can continue the discussion here in the state. Senate Bill, I'll draw your attention to Senate Bill 369 and Senate Bill 370. These are both bills from State Senator Karen Talion from Northwest Indiana, dealing again with the Medicaid expansion issue. Senate Bill 369 would just expand our traditional Medicaid program as was originally prescribed by the Affordable Care Act. And then Senate Bill 370 would actually follow more closely with what we term the Arkansas model. This is a program that Arkansas has negotiated with the federal government where the Medicaid dollars are coming into the state, and then the state is then able to use those dollars to help low-income individuals with premium supports to buy private insurance plans. So this is one mechanism that has been approved around the country to expand Medicaid, and this bill would take the state in that route. So obviously something that we're engaging with her on and following along closely. We'll draw your attention to the fact that the Governor Pence requested a meeting with Secretary Sebelius in September to negotiate on this issue.
February.
February. So we fully expect that meeting to take place towards the end of February, where some negotiations will continue to happen between the governor's office and HHS and CMS on finding some ways to expand the Medicaid program. The governor continues to call for an expansion of the Healthy Indiana program, using a lot of the guidelines and principles of that program as our vehicle for expansion. But we fully expect some other negotiations to take place.
Right, and just to follow up on so that this whole issue of ACA implementation, while there are these bills that David has just described, quite honestly, there's not a lot of hope that the bills are going to move forward. And from the Cover Indiana campaign perspective, which is the advocacy campaign to expand coverage, there's sort of a two-pronged approach or a three-pronged approach of really trying to encourage the governor to continue with those negotiations just so that no one is left out, urging legislators to hold some type of hearing. Honestly, not any of those bills is perfect from the advocate's perspective, but it at least creates the conversation. So that's sort of the outlook for the coverage expansion or state-based exchange bills that are happening.
And then I'll just, won't cover everything here, but I'll draw your attention to the pseudoephedrine by prescription bills. One of these bills, I believe House Bill 1106, will have a hearing Monday morning in the House of Representatives. These bills are dealing with access to pseudoephedrine. There's a discussion that's been taking place the last couple of years about the meth problems that are plaguing local communities around the state, and whether access to pseudoephedrine should only be by prescription or should be continued to be able to be accessed over the counter, although with some obviously restrictions in place, the current safety programs that are already in place with regards to showing ID and only being able to buy certain amounts in certain time periods. But there will be a bill heard next week to make pseudoephedrine by prescription only. So there's some considerations on both sides about the meth problem, but also access to health care for low-income residents, and whether they would have to go see a doctor to receive a prescription every time they need to buy some cold medicine.
Great. So as David mentioned, we're not going to talk through every one of these bills. Not all of the bills that we have listed are moving forward. Some of the bills have sort of a minor impact, but certainly if any of you have a question about a specific bill, we will come back at the end and go through question and answers because we have lots of bills to talk about, as you can see. So continuing around the Healthy Hoosiers issue, probably the most important or the biggest things from a Coalition of Human Services perspective on this slide relate perhaps to some of the eligibility benefits issues, and one that's getting a lot of media attention is that one listed there at the bottom, House Bill 1351. And David, I don't know if you want to offer any information about that. I know our coalition partners around the state have been very interested in that drug testing issue.
Sure. This is a very similar bill. This is the third year that we've seen attempts to drug test TANF recipients. So this bill is very similar to the bill that we saw last year, and basically it would be a multi-step process for current individuals on receiving TANF cash assistance and those applying to receive cash assistance would first receive a written assessment test that they would have to take that would determine their propensity for an addiction, and if that test came back positive, they would be further drug tested before they entered the program. The coalition continues to oppose this legislation basically from a cost-benefit analysis. The fiscal cost of this bill just on the TANF provisions is $1.42 million. Currently, Indiana only has about 10 to 12,000 families on the TANF program, so we are looking at a very small testing population, and programs that have been conducted in other states around the country continue to find only 1 to 3% of individuals either on or applying to the TANF program failing those drug tests. So certainly not condoning drug use in any way or fashion, but just continue to have a discussion with our legislators about the cost of the program and whether those dollars in a very finite TANF pot that we receive will really be utilized in the best way if we're diverting over $1 million to this drug testing program. This year, again, going back to the idea that we're talking a little bit more about entitlement reform, there were a couple of extra provisions in the bill this year regarding the SNAP program. The first was to show photo IDs to use EBT cards, and then the second provision is around requesting a waiver from USDA to place nutritional guidelines on the SNAP program and only allow those dollars to be used on what is determined to be nutritious food. So trying to prevent people from buying those sort of highly processed junk food with their SNAP benefits. The photo ID provision was amended out of the bill at the chairwoman's request, but the nutritious foods waiver request is still in the bill. And we're just continuing to have those discussions, again, to let them know what kind of barriers individuals on the SNAP program are facing with access to nutritious foods, access to grocery stores, and not just convenience stores, whether they find themselves in food deserts, and just the level of benefits that they're receiving on SNAP and their ability to find those nutritious foods, and see if we can come up with some better ways to look at that issue. But entitlement reform, a very big issue, and one that we'll continue to be looking at probably over the next few sessions.
Okay, I'm getting a couple comments, and thank you very much for letting us know through the question and answer or the chat box. We understand that the audio is not consistent, that blocks of words are not being communicated. So if it's happening with one of us or the other of us, if it happens more with David or more with Lucinda, if you could let us know that, that would help us with the connection, and we will, of course, try to use our good speaking voices. So thanks for the update on that, and that may affect our recording as well. One other comment about the welfare benefit bills, the eligibility or entitlement reform. Those of you, I know we have lots of our partners around the state really care about this issue. And one of the things that we have identified as we've talked with legislators is that there's just a lack of awareness of, for example, how few people are actually on TANF and how little cash assistance actually happens with those families, and how many hoops they have to jump through already to receive TANF. And in the same way, there's a misconception about how much SNAP benefits most individuals receive, and as David was mentioning, how difficult it is to find nutritious food, especially if an individual or family lives in a food desert. So for those of you who are really passionate about the eligibility benefits or SNAP or TANF, please, one thing you can do is help educate your legislators about poverty and how folks work or live and are just trying to make ends meet. One other bill that I'll just call your attention to, because I know we have a number of disability advocates who participate in our webinars, is related to Senate Bill 419, and that simply allows children who are diagnosed with autism at a later age to be added to the birth problems registry. So it ups the age for that registration. So I know we are only on a first few slides, so we will try to move a little faster. I do want to call your attention around our Healthy Hoosiers area to the CHOICE program, in that House Bill 1391 was heard and passed unanimously out of committee yesterday. This bill actually provides a greater flexibility for individuals who have disabilities and seniors to use this CHOICE program in terms of it takes away that sort of need, it really bases it on a need rather than some sort of eligibility criteria. So it's aimed at helping more seniors and people with disabilities be able to stay in their homes with appropriate levels of services and incorporate their families and friends into their caregiving. So advocates are really excited that that CHOICE bill is moving forward. There are a number of issues that relate to people with disabilities and brain injuries that are moving forward. The one specifically around guardianship issues, around divorce for people with intellectual disabilities, and that is I can't remember, one of those is moving forward. I apologize. If someone has a question, we can look that up. Any other programs on this page, David, that you want to call folks' attention to?
No, thank you.
Okay. Moving on, we've already talked a little bit. David gave a great explanation of where we are with the Affordable Care Act implementation. But just as David mentioned, while the ACA was actually enacted in 2010, 2014 seems like a very heavy year for the ACA because the individual mandate goes into effect, and we have this open enrollment period that runs through March 31st into the marketplace. We are participating in that federally facilitated marketplace, so people between 100% and 400% of poverty can purchase insurance on that exchange. Again, that open enrollment period ends at the end of March, and while it did have some hiccups at the beginning of October and through about mid-November, nearly 30,000 people have signed up on the exchange, so that's really great improvements. David talked about how Governor Pence is meeting with Director Sebelius in late February to talk about use of the Healthy Indiana Plan, and then this group called Cover Indiana continues to work on the issue of the coverage gap, and we can tell you a little bit more about how to get involved with Cover Indiana if that's one of your passions. So let's talk a little bit about Working Hoosiers. And David, I don't know which one of these bills you would like to call folks' attention to.
Well, I think, although I'm certainly not an expert, I think I would call attention to 1346. This bill is going to make some major changes to the unemployment insurance system, sort of, as Lucinda has put here in the slide, lowering the burden of proof on employers, changing some of the guidelines and provisions around employment drug testing and how that could affect unemployment benefits being paid out to a worker that has been fired or let go. So there are some very big changes that could potentially happen in this bill. So if unemployment insurance is something that you're interested in, definitely take a look at House Bill 1346.
Great. And the one that I know that the transit bill is being heard next week, and the one that for those who are really involved in financial stability issues, who deal with trying to improve people's credit scores, there's a good bill, Senate Bill 175, that is moving through, and that deals with the dilemma that some folks get into if they're applying for a particular, like maybe to purchase a car or something. Sometimes if you shop around, you have multiple requests on your credit score, and having multiple requests can actually lower your credit score. So this bill tries to address that.
Yeah, and then I'll just hit that last bullet point there, just to say that there were a couple of bills introduced this year by a number of different legislators looking to raise the minimum wage in Indiana. Obviously, this is a discussion that's going on nationally, as well as many other states, to raise the minimum wage. Those bills will not get a hearing this year. There was an amendment that was debated on the floor of the House earlier this week, just to offer a study of raising the minimum wage and what its effect would be here in Indiana, and that amendment failed on a party line vote. So obviously the discussion around raising the minimum wage here in Indiana will probably be one that comes back again in future sessions, but one that's going to be fairly contentious.
Thanks for that update. So let's move on and talk about our next area, and that's the workforce-ready graduates, early care and education. This is something at Indiana United Ways that we are very, very invested in and passionate about. So I'll just give you the quick woohoo. Early education is getting a lot of attention in that the House Bill 1004, which is also called the Pre-K bill, or Early Education Voucher Bill, it has actually passed the House and moved on to the Senate. There are some things that are in that bill that are somewhat controversial and may face additional amendments on the Senate side, but essentially it provides a voucher for low-income 4- and 5-year-olds to attend a high-quality pre-K, and high quality is defined by a certain level on Paths to Quality or the equivalent. We're very excited that House Bill 1036, which is would raise the requirements for those child care providers that take CCDF, that taxpayer subsidized voucher program for low-income families. And 1036 is expected to be heard on the House floor on Monday. So we're very excited, and if you also are passionate about early education, we would encourage you to reach out and let your legislators know that House Bill 1036 is a good bill. Again, it only applies to those who take the taxpayer funds. And there's bipartisan support, really good support for that. There are some other early education bills that are moving, and if you have questions or if you are an early education advocate and you are not receiving my internal updates, feel free to email me and I'd be happy to add you to a separate internal list that goes just to early education advocates. In the education area, we're still seeing a number of other bills related to the cursive writing bill is back. There's a bill around teacher qualifications and school bus safety. There's going to be a hearing on the in-state tuition for Dreamers. That's the children of who were undocumented, who graduate from an Indiana high school to be able to go to college. So there are a number of bills that are active in this session. And David, I don't know if you want to call attention to any others.
No, thank you.
Okay. And we'd be happy to answer questions at the end again. Workforce-ready graduates, there are a number of bills related to child services that we, in our new structure, didn't have a great place to put. But as David had mentioned, it's a governor's priority that attention be given to adoption. So there is a bill that will create an adoption tax credit that aligns with the federal credit and the creation of an adoption study committee. So there are some other bills related to children's issues. Over the last several years, there's been a lot of attention to the Department of Child Services and the creation of the Commission on the Status of Children that have met and provided recommendations to legislators about how to improve, and many of those improvements are still underway. David, do you have anything else to add on the child services?
Oh, thank you.
Okay. And then lastly, an area where ICHS looks at a number of different issues is this area of thriving communities. Many of these bills are not actually moving forward. For example, the nuclear energy bill is not moving forward yet. I don't think it will be at all, in fact, this year. This year we have seen a couple of firearm bills, and we know that some of our partners around the state have concerns about some of the firearm legislation. So just to be aware that there is one that's moving, and David, I don't know if you want to give a quick update about that 1048?
Sure. So 1048 deals with a piece of firearm legislation that was put into place about 5 years ago now that would allow individuals to keep firearms locked in a car on private employer property. That an employer could not prohibit an employee from keeping a firearm in a locked vehicle out of sight on their property. There were a number of exemptions that were placed in that bill when it passed about 5 years ago, dealing with certain locations that would still be able to determine for themselves whether that would apply or not. This included school property, child care centers, residential and group facilities, and a couple of other places. House Bill 1048 will simply remove the school property exemption. So from now on, public and charter schools, and I believe this would apply to private as well, but I'm not entirely sure on that, will not be able to prohibit visitors or employees from keeping a firearm locked in their vehicle on that property. I'm not exactly sure what the emphasis is for removing that exemption. I would suspect that it could have something to do with recent events in the last year to year and a half, but I'm not entirely sure there. But it's something definitely to keep an eye on if you are interested in a school property, school facility, and what that means for firearm policies.
Great, thank you. All right, we will move on. We had a question a little earlier that I'll just go back to. I had a question of clarification about Medicaid related to how many folks were actually, not Medicaid, but the Marketplace, how many folks were actually enrolled. I had mentioned that 30,000 had enrolled in that last quarter, just a little over 30,000, and that was 30,000 in Indiana, not across the country, just 30,000 in Indiana, and in fact 40,000 had enrolled in Medicaid as a result of that. So if you have questions about anything we've mentioned, please feel free to add those in the question box or the chat box. So we'll move on to the thriving communities in the area of good government. One of our partners is the League of Women Voters as a part of our coalition, and they, with a number of other partners, really pay attention to election issues. David, do you want to describe what's happening or just mention that 1032 is moving forward about redistricting?
Sure. So this is, again, Lucinda said one of our partners is the League of Women Voters. This is an issue that they, as well as a number of other partners around the state, have been working on. And basically what 1032 would seek to do would be to remove the redistricting process from sort of a political process where the maps are drawn by the General Assembly to an independent commission that would draw those maps. Certainly there's some element of politics when the legislature itself is drawing their own maps. So in an effort to increase the number of competitive districts around the state, and maybe sort of change some of the political dialogue that we've seen in the last few years. The bill would seek to take that process away from the General Assembly and give it to a nonpartisan redistricting commission.
Great. Thank you. I did get another question as we were talking about Senate Bill 286. I'll just go back to that. That was actually a bill related to felons, former felons, who currently are not able to receive certain benefits, and like, for example, SNAP. We are aware that these types of bills have been introduced every year. There's a real desire to allow folks who get out of prison to be able to get a fresh start and really get a good job and have access to benefits if needed. Many of these bills have been introduced year after year. I am not aware that either of the benefits for former felon bills are moving forward. Are you aware of anything, David?
No, I'm not, and I would not suspect them to be.
Okay, thank you. So now we're going to change gears just a little bit and offer you some resources that you can use, as well as some additional information at the federal level. So we want to call your attention to the Guide to Safety Net Programs, which is available on the website for ICHS. And this has been updated since last year. So if you work with basic needs issues, where you are trying to educate your caseworkers or you're trying to educate your board members, for example, about some of the safety net programs like what is Medicaid, how does Medicaid work, what is TANF, how does TANF work, what is SNAP, oh, how poor do you have to be to receive SNAP? Those kinds of questions are answered in this guide. We can as we did our tour around the state last year, we brought these guides to many of your communities, and we know that they were very popular. You can certainly download it off our website. If you have the ability to print them in-house, I can send you the actual copy to print, or if you want to request some to print, you can email us and let us know. We want to give you a quick update about what's happening in Congress, because we've a lot of our funding for human services comes from the federal government through the state. And so we always like to give you a quick update of what is happening in Congress. Very excited that in the last week, President Obama signed the spending bill for this year, which means we won't have necessarily a government shutdown again, and that we actually have a federal budget that runs through September. Very pleased that it preserved human services and even offered increases in certain areas. So we've tried to highlight some of those areas that are really important to our partners around the state and to United Ways. So if you have any questions about any of those programs that are listed, like Head Start or the Child Care Development Block Grant or the Emergency Food and Shelter Program or some of the workforce programs, there was a slight increase, for example, for Section 8. We know that folks in the housing community have been very concerned about some of the cuts that have happened in recent years, how SNAP and WIC were funded, and we know that WIC is going through a process where it's going to be shifting to an EBT card. There were some funds included for that, and then we know, especially in this very cold winter, how important LIHEAP, the Low-Income Heating and Energy Assistance Program, is to our state. So this just gives you a quick summary of some of the inclusions in the federal budget. Also at the federal level, they continue to have conversations about tax reform and providing some sort of comprehensive tax reform package. And this really comes from that desire to, align spending with revenues and to streamline the tax system. So we, from a United Way perspective, continue to be a very strong advocate around the charitable deduction and preserving that, because we know for our nonprofit partners how important the charitable deduction is for you to be able to raise dollars from donors. Those of you who really work with low-income and working Hoosiers know how important the Earned Income Tax Credit is and the Child Tax Credit. They are on the table in this tax discussion. So we know that in some other states, the state types of credits of these have been converted from refundable credits to non-refundable credits. So we're monitoring those federal issues as well. Right now they're preserved, but we want to keep you aware of how changes are happening in tax reform, changes with SNAP, and in entitlement reform. You know that in the larger community of human services, there's a lot of conversation right now about entitlement reform. And as a coalition, we're really starting to explore how do we reframe the message, because we're not just about providing free services to clients, but to help people and empower people to work to the best of their ability, but that people do fall on hard times, and how do we ensure that a safety net is provided. So we're going to switch gears for just a couple minutes. We always like to give our 5 minutes of, hey, remember that you are allowed to advocate, you are allowed to lobby. We always get nonprofits participating in our webinars and in our trainings across the state who tell us that either their board members have told them they're not allowed to, or their attorney has told them they're not allowed to. Nonprofits are allowed to lobby, they are allowed to educate, they are allowed to advocate. You just have to know the rules and know that when you have your volunteers telling your story, your board members telling your stories, some of the rules about reporting don't actually apply to you. What we really want to emphasize in this first of our 3 webinar sessions, this legislative session, is that if you want to have an impact on legislation this session in 2014, the time to act is now. So how do you get started? Know that one of the first ways to get started in advocacy is to think about what your organization does and think about how it connects to programs. So if you receive government dollars, you have a direct connection to public policy. If you are serving people in your social service agency or your human service agency that also benefit from these programs, you have a direct or maybe an indirect connection to public policy. So we always encourage nonprofits to get your board or your committees involved, because staff shouldn't just act on their own in terms of advocacy. Certainly all of you can act as an individual, but you have to be very careful when you're talking from the perspective of your organization. So make sure that you have your board or your committee members endorse or approve the kind of positions that you're going to take, or your engagement in some sort of process. But there are lots of things you can do. You can have your board members maybe sign a letter to the editor or a guest column, or be interviewed in the media, because you are resources for your media about how is the healthcare law impacting your clients? How would this change to TANF affect the people you serve? How would the concussion bill, affect the children in your program, whatever the bill is. But we encourage you to engage your board members and your volunteers into those discussions. Oh, this is an outdated slide. I apologize. I'm going to skip this slide, because what the slide that you have in your packet actually is the right slide. But we encourage you to work with us. First, there are 3 newsletters that we'd like to let you know about. One is our Indiana Association of United Ways offers a policy update every odd Friday. So first, third, and fifth Fridays, we have a newsletter that goes out. The Indiana Coalition of Human Services also has a newsletter. And then we have weekly updates coming out about Cover Indiana, around the coverage gap issue, because right now is such a critical time for our state to be making decisions about coverage. We encourage that you work with us. We invite you all as participants in this webinar that you are now part of our network, and that, as you're hearing things in your local community, let us know so that you can be our eyes and ears locally, and we can be your eyes and ears in Indianapolis in the State House. Both of our organizations do produce bill lists, and they are posted every week on our website. And we also maintain a third house calendar. So if you don't know what a third house session is, it's basically a meet your legislator session in your community. Many times all of the legislators who represent your area will be invited. It might be convened at your local library or by the League of Women Voters or by your local chamber. The legislators will provide a quick update, and then they provide an opportunity for question and answer. So it's really important for us to hear from you about how those local third house sessions are going. We invite you to come to the State House. If you've never been to the State House, please come, and if you are part of the United Way Network or part of the Coalition for Human Services, find us and we will actually help walk you through the process, especially if you've never been to the State House. From an ICHS perspective, and we try to coordinate testimony, so if you have a great story to tell about one of those bills that are moving, you can share your story, share your client's story with permission, of course, or invite them to come to the State House, and we can help put that together with you. And then we participate in a number of coalitions, so there's a lot of overlap of how we all work together, because as Human Service Network, you know, there's just not enough resources to go around, so we all work together through the Coalition for Human Services, through the Children's Coalition, through this Cover Indiana campaign, or through the Transit Coalition. And then there you see some of the websites that we have talked about with their actual links. We will, at the conclusion of this session, after the recording is made, assuming the recording is of high quality enough to post, we will post it with the copy of the slides, and the slides will actually have the direct links to the bills so that you could link directly from the slides. But call your attention to the Coalition for Human Services and the Cover Indiana. Both of those have newsletters as well as IUW through the Indiana Association of United Ways. We will highlight that the General Assembly's website has been updated this year, and it does have some challenges with some things aren't quite posted as quickly as we had hoped, or it may be slow sometimes. But one of the nice parts about the General Assembly's website is that you can actually sit from the comfort of your office in Elkhart or Crown Point or New Albany or Evansville, wherever you are in the state, and you can watch the hearings and watch the floor action from your own office. And then lastly, we include some helpful websites, particularly if you're just engaging in the nonprofit advocacy area and you want to learn more about how that works. So let's go back to questions. We have a few more minutes before we conclude, so we want to ask, are there any other questions about any of the bills that we've mentioned, or some of the current activities, or sort of big picture thinking about any of the topics we've covered? I'm looking in the chat box to see, or the question box, to see if we have any questions. Okay, I had a question about 1032. Does 1032, I don't remember 1032 off the top of my head. And we are looking. So 1032 is the Redistricting Commission. So what kind of prospects does 1032 have of passing?
I think it has a possible. It's possible that it could pass. I think that if it does, it's going to be pretty highly amended. I'm not a real expert on this bill. We certainly have some members of our coalition that we can look to get some better updates and answers on this bill. But I would think that it will be very hard right now to sort of wrest control entirely of the redistricting process from the political side of the equation. But I think something, at least demonstrating the will of the state to move towards a more bipartisan or nonpartisan way of redistricting could pass the General Assembly this year.
Okay, so cautiously hopeful would probably be a way,
I think
and likely amended. Cautiously hopeful, likely amended. We have another question, and that's asking about House Bill 1137, which is the Reporting of Sex Crimes with Children bill. And this bill, I only know a little bit about. David probably knows more. It's about the fact that in Indiana we do not track sex crimes with children as well as we should. Is that correct, David?
Yeah, I think that's really what Representative Hale is looking at. This is a real, she's a real champion of this issue. I know this is one of her priority issues. I think the statistic is something like 1 in 6 girls in Indiana will be sexually assaulted at some point in their lives. So really a big issue for her. And what this bill is basically asking at this point is that at least one of our statutory commissions over the summer look into how we can make some changes from a policy perspective to reduce or eliminate sexual assault against girls in the state.
Right. And in terms of the likelihood of it going forward, I don't think it's been scheduled for a hearing yet.
I don't see that it's been scheduled, but talking with Representative Hale just a little bit about this bill, she seemed fairly confident that they could get something around this issue done this year. Okay.
And just as a point of clarification, because this is a short session, it is, we've only been in session just at 2 weeks, and with some snow issues in between, the session is moving very, very fast. So it is the first week of January that we are expected to have, the first week of February, bills are expected to be done in the first chamber and then start to move over to the second chamber in February. So it's a very, very fast session this year. So that's why if we tell you that things have not been scheduled for a hearing yet, or if you look online and you see that bills have not been scheduled for a hearing, it may not be likely that they could be scheduled. However, elements of those bills could always be introduced as an amendment at a future time. There are some rules about that. We could go into the detail, but that's way too much in the weeds. I'm not seeing any other questions. I'll ask if there are any other questions, and if not, we will wrap up. Going once. Okay, no additional questions. I see. A nice job. Thank you. So this, here you see our contact information. We are just 3 of the individuals through the Coalition for Human Services, and you are welcome to let us know if you have specific questions about a specific issue or a specific bill, or how you would like to get involved or get help. Get connected into this network. So one of the frequently asked questions that we get is, will we send out, after this session, we will send out an updated set of the slides and a copy of the recorded webinar for those. If you felt that this had value and you'd like to share, you could actually provide that link to your colleagues. We do have 2 other sessions later in this legislative session, one at about the midway point to let you know which bills survived through the first chamber, and then one as a wrap-up session, and that's after the session concludes and adjourns after March 14th. So we invite you to participate in those webinars. And again, thank you so much for all that you do on behalf of people in need in our state. So thank you, and that concludes this webinar.